Hello everyone. In this video we will see about the anatomy of calcaneus bone. So this is the calcaneus. It is one of the tarsal bone of our foot. It is the largest bone in the tarsals and it is located horizontally like this. So this is the anterior part of this bone. This anterior part, as we can see, this is convex at the sides and concave in the middle. This part articulates with the cuboid to form calcaneocuboid joint. So this is the anterior surface. Then this is the posterior surface. This posterior surface of the calcaneum is divided into three parts: the upper 1/3, the middle, and the lower 1/3. The upper 1/3 part is smooth and it is related to the bursa. This middle 1/3 part, it is giving attachment to the tendo Achilles or Achilles tendon, and this lower 1/3 part, this is subcutaneous, occupied by the fibrofatty tissue. Then we have the superior surface. So this superior surface has been divided into three parts: the anterior 1/3, the middle 1/3, and this is the posterior 1/3. This anterior 1/3 has been again classified into the articular medial part, and this is the non-articular part. This non-articular part is slightly depressed. This depressed area is known as sulcus calcanei. Then this is the middle 1/3 part on the superior surface. This is articulating with the facet on the inferior aspect of the talus, and this is the posterior 1/3 part of the bone, which is occupied by the fibrofatty tissue. In the anterior 1/3 part, this is the articular part, and it is having the facets. This is the anterior facet and this is the middle facet. This anterior facet articulates with the anterior facet on the inferior aspect of the talus, and this middle facet articulates with the posterior facet on the inferior surface of the talus. This is the posterior facet. This is also articulating with the facet on the inferior aspect of the talus. Then this is the lateral surface of the calcaneus. On the lateral surface we can see this elevation. This is known as peroneal trochlea. This peroneal trochlea is having superiorly a groove. This groove is for the peroneus longus muscle, and the groove below it, this is occupied by the peroneus brevis muscle. Then this is the lateral surface of this bone. On the lateral surface we can see this projecting part. This is known as sustentaculum talli, and the groove beneath this sustentaculum talli, this is occupied by the flexor hallucis longus. Then this is the medial concave part on the lateral surface. This is occupied by the origin of flexor digitorum accessorius muscle. Then we have the inferior surface. This inferior surface is occupied by the three tuberosities. This larger tuberosity is the medial one, and this smaller is the lateral tuberosity. Both these are the medial calcanean tuberosity. This is the anterior tubercle. The anterior tubercle, in its anterior part, it is providing attachment to the small plantar ligaments. Then we come to the attachments of this bone. Now the attachments on the superior surface of the calcaneum includes, this is the anterior 1/3 part on the superior surface. This is the non-articular part. This non-articular part gives attachment to the cervical and interosseous talocalcanean ligament. Also, anterior to this we have the stem of bifurcate ligament. This is the attachment of stem of bifurcate ligament. Then just below it we have the attachment of the stem of inferior extensor retinaculum. So these structures, these ligaments are attached on the anterior non-articular part on the superior surface of the calcaneus. Then just lateral to it we have the origin of extensor digitorum brevis muscle. So this is the origin of extensor digitorum brevis. Then just behind this, on the middle 1/3, here we have the posterior facet. This is the posterior facet for the talus, and this is the posterior 1/3 part on the superior surface, which is occupied by the fibrofatty tissue. On the inferior surface this anterior tubercle gives attachment to the short plantar ligaments. Then posterior to it, the area between the anterior tubercle and the calcanean tuberosity. This provides attachment to the long plantar ligaments. Then just lateral to it, in the posterior aspect, we have the origin of lateral head of flexor digitorum accessorius muscle and the abductor digiti minimi muscle. Then just anterior to the medial tuberosity, we have the origin of this flexor digitorum brevis muscle, and we have the origin of abductor hallucis just close to it, medial tuberosity, this medial calcanean tuberosity. Then just anterior to the attachment of long plantar ligament, we have, this is the origin of medial head of flexor digitorum accessorius, which is continued on the medial aspect of the medial surface, medial concave area on the medial surface of calcaneum. So on this medial concave area below the sustentaculum tali, we have, this is the origin of flexor digitorum accessorius. This is the origin of medial head of flexor digitorum accessorius muscle. Now this is the sustentaculum tali. The attachment and the relation on the medial aspect are as follows. The groove on the lower surface, this is occupied by the tendon of flexor hallucis longus. Then the medial margin of the sustentaculum tali is related to the tendon of flexor digitorum longus, and this sustentaculum tali provides attachment to the spring ligament on the anterior side, then a slip of tibialis posterior in the middle, then some superficial fibers of the deltoid ligament along the whole length, and then we have the medial talocalcanean ligament in the posterior side. So this is the attachments of the calcaneus. I hope you understand well. Thanks for watching.